Good afternoon, everybody, and welcome to today's policy forum, Catalyzing AI to Advance Health Equity in California Communities. My name is Jana Wright, and I am the Director of Policy at Insure the Uninsured Project, but better known as ITUP. Thank you again for joining us today to explore an exciting and transformative topic, artificial intelligence. AI is increasingly becoming a cornerstone in streamlining healthcare delivery with applications ranging from scheduling appointments to managing population health. Before we dig into today's topic, though, I want to give a few housekeeping reminders. So, the first is that this session is going to be recorded. Next slide, please. The meeting links and resources will be emailed to all the participants and posted to the ITUP website after the meeting. If you need closed captioning, that is available. And to enable captions, please select the CC or transcript icon from your toolbar. You can submit your questions at any time today during today's webinar and using the Q&A function from your toolbar as well. Chat is open and we highly encourage you to engage throughout today's discussion. Next slide, please. I want to center you today also on our agenda. So we're first going to do a little welcome and introductions by me. I'll pass it then over to Akuna and Shirley, ITUP staff, to set the context for today's conversation. And then we will go deeper into our panel discussion with our panelists today. But really, we just want to first focus on ITUP and how we come to this space today. So our policy priority areas, yes. And if you would like to introduce yourself in the chat, please feel free to do so. I already see Sarah is doing that. So thank you, Sarah, for taking the lead there and reminding us all to do so. For our policy priority areas today at ITUP, these include coverage and access, as well as delivery system transformation and the future of health. The last policy priority, though, the future of health, aligns with today's conversations. And today we're going to explore how we can use the power of emerging technologies to enhance health equity. Next slide, please. So as our name implies, ITUP was launched nearly 30 years ago in response to the high rate of the uninsured in California. Through policy reforms such as the Affordable Care Act and the expansion of Medi-Cal for immigrants and communities, we have seen the uninsured rate significantly decrease. So today, ITUP's focus is on bridging the gap from coverage to access. We understand that it is one thing to have an insurance card in your wallet, but it is entirely a different thing to access equitable care. In addition to policy analysis, next slide, please, ITUP convenes regional stakeholders through opportunities such as our regional equity collaboratives and amplifies community voices to our partners in Sacramento to shape policy. ITUP is uniquely positioned to keep a pulse on what's happening in our communities, as well as while holding a macro level perspective of what is happening statewide. And next slide, please. If you haven't visited our website in a while, I highly encourage you to do so. There's lots of exciting things on there, such as our latest AI fact sheet, an AI policy toolkit, and our coverage fact sheet series, which we have a statewide coverage fact sheet as well as 10 regional fact sheets in that series. So I highly encourage you to check those out. And I want to now introduce Akuna Shalaka and Shirley Lamb. So Akuna is our graduate policy intern and Shirley Lamb is our assistant director of policy. They are going to be setting the context for today's conversation. Akuna, I'm going to turn it over to you now. Thank you so much.
All right. Thank you, Janice. And hello, everyone. Thank you all for attending today's Policy Forum. My name is Shirley Lamb, Assistant Director of Policy, and I'm joined by my colleague, Akuna Jeanette Chalaka, one of ITUP's extraordinary health policy interns, who led the research of the latest ITUP fact sheet, Catalyzing AI to Advance Health Equity in California Communities. In the next 10 or so minutes, we'll guide and explore the critical role artificial intelligence has in shaping the future of healthcare. So the title of the fact sheet is Catalyzing AI to Advance Health Equity in California Communities, outlining the importance of AI in enhancing patient care, improving efficiency, and driving innovation within the health sector. So what is AI? Well, for ITUP, we define AI as technology that enables machines to simulate human intelligence and problem solving. So that mimics human autonomy, allowing AI systems to make predictions, recommendations, or decisions that influence real or virtual environments. AI systems learn from human input data to conduct such activities, particularly automated tasks. And AI is a rapidly evolving tool, being the technology behind smart assistants like Siri and Alexa, and large language models like OpenAI's ChatGPT. But it also plays a significant role in revolutionizing healthcare, driving innovation, enhancing efficiency and accuracy, and ultimately improving better health outcomes. So, in complementary fashion, ITUB also created an AI policy toolkit titled The Emergence of Artificial Intelligence and its application in health. Here in this image is the second page of the toolkit that illustrates the history of AI in healthcare, as it dates back to as early as the 1950s and has progressively and rapidly become integrated into medical practice and research. So the question enters, why is AI important to the future of healthcare? As I'm sure many are aware and are feeling the impacts of the unprecedented healthcare workforce crisis, the COVID-19 pandemic further exacerbated the issue as there are not enough health workers to meet the needs of California's increasingly diverse, growing, and aging population. AI holds promise to transform the healthcare delivery system by cutting costs and making it more efficient, personalized, and accessible for all Californians. AI algorithms can analyze individual patient data to personalize treatments and interventions, provide patients with quick answers to basic health questions, and assist providers by scribing appointment notes. Additionally, AI automates administrative tasks such as scheduling appointments, improving efficiency across the healthcare system. Telehealth platforms and AI-powered diagnostics can also improve access to healthcare services, especially in underserved or remote areas where healthcare infrastructure is limited, thus bridging the gap in healthcare access and reducing health disparities. AI also contributes to early diseases detection and predictive analytics, identifying at-risk populations and potentially reducing the burden and disparities in chronic diseases. So there are also numerous federal agencies that hold various roles and responsibilities concerning the usage of AI in healthcare. These agencies are essential in collaboratively addressing regulatory challenges, fostering innovation, safeguarding patient privacy, and ensuring that AI technologies in healthcare deliver safe, effective, and equitable outcomes for both patients and providers. Specifically, the Office of Science and Technology Policy issued a blueprint for an AI Bill of Rights, emphasizing the ethical principles, human rights, and societal values in shaping the future development and deployment of AI technologies, including protections against algorithmic discrimination. In California, oversight and regulation of AI usage in healthcare primarily fall under state agencies responsible for healthcare regulation, consumer protection, and privacy. You'll hear in a little bit more from one of our panelists from the Department of Technology, but in the policy toolkit, you'll get more details about how each key state agency may have jurisdiction or can play significant roles in overseeing AI usage in healthcare. I'll pass it off to Akuna to take you through the remaining slides in our time together. Akuna, take it away.
Thank you so much for that insightful information, Shirley. As we can see, there is significant AI policy action occurring at the federal level. Such is also the case in California. For instance, Cover California is leading the way in utilizing AI in healthcare operations. Since partnering with Google Cloud's AI solution, Document AI, this past April, Cover California has streamlined and automated the healthcare eligibility verification process, particularly the repetitive task of verifying resident information. This use of AI technology has improved both the speed and accuracy of data extraction. Beyond Cover California, policymakers are actively introducing legislation to regulate AI and deploy guardrails, with 50 AI-related bills being introduced in the 2024 session alone. For instance, Senator Wiener's SB 1047 aims to set safety standards for large-scale AI systems, ensuring that these technologies are developed responsibly. Additionally, Senator Padilla's SB 892 tasked the California Department of Technology to create safety, privacy, and non-discrimination standards for AI services. Such bills lay the groundwork for safeguarding consumers and preventing potential misuse of AI in healthcare and various other sectors. Clearly, AI holds immense promise for healthcare delivery in California. However, it is still imperative to approach its integration into healthcare with a healthy amount of skepticism. Since AI algorithms are reliant on inputted data, AI models are only as good as the data they are trained on. Thus, biased, inaccurate data can lead to widespread algorithmic bias. This is particularly concerning in healthcare, where such biases could perpetuate or even worsen existing health disparities. Additionally, issues like patient rights, patient privacy, and the affordability and accessibility of AI-driven health solutions to marginalized, underserved communities must be carefully considered. Our AI fact sheet has a section that lays out some further policy considerations on engaging with AI to ensure its equitable, race-conscious deployment in healthcare. Ultimately, AI has the potential to revolutionize how health professionals deliver services, making the healthcare system overall more efficient and equitable. However, as California continues to innovate, it is imperative and important that stakeholders balance AI's benefits with thoughtful regulations and ethical safeguards. By addressing these challenges and issues head on, we can ensure that AI truly serves the healthcare needs of all Californians, especially the most vulnerable. Thank you so much for your time, and please don't forget to check out iTup's AI publications. If you have any further questions, feel free to reach out to myself and Shirley Lamb. Now I'll pass it back to Jana to start the panel discussion. Thank you so much.
Thank you so much, Akuna and Shirley. Well done. We really appreciate that thoughtful overview and setting the context, particularly the policy considerations around an anti-racist framework for AI technology and policies. I want to ask our audience if there are any questions you have for Shirley and Akuna. Feel free to put those in the chat now. We have a couple of minutes before we get started our panel, so I want to open up the floor to any audience questions that may be coming in. Not seeing anything on my end, but that's okay. We're going to have a separate question answer period at the end of our panel. If we need to bring Shirley and Akuna back in, we can for that. So again, thank you so much. I am joined today by our three panelists, Dr. Jason Cunningham, the CEO of West County Health Centers, Dr. Johanna Liu, the president and CEO of San Francisco Community Clinic Consortium, and then Jonathan Pratt, our state chief technology officer at the California Department of Technology, who'll be joining us shortly. Before we dig into our discussion questions today, I'd like to give you each just an opportunity to introduce yourselves. Jason, can you start us off, followed by Joanna?
Thank you, Jana. My name is Jason Cunningham. I'm a family physician and the CEO at West County Health Centers. We're a federally qualified health center serving patients in the western part of Sonoma County, roughly about 12,000 patients we serve here.
Thank you so much, Dr. Cunningham. And Dr. Liu, would you like to introduce yourself at this point?
Yes, thank you. Hi, I'm Johanna Liu, President and CEO at the San Francisco Community Clinic Consortium. We're a regional partnership of 12 community health centers, maybe similar to Dr. Cunningham's clinics, but all located within the city and county of San Francisco. Collectively operate around 30 sites on the 7 by 7 square miles that makes up San Francisco and serves a little over 110,000 patients a year.
No small potatoes, either of you are roasting, and I appreciate you spending some time with us today. And I see Jonathan Pratt. Hi, Jonathan. Would you like to introduce yourself to the audience today? Thank you so much for being here.
Yeah, thank you so much for having me, and excited to hear from my fellow panelists. I'm Jonathan Pratt. I'm the State Chief Technology Officer for the state of California. I manage our offices of digital services, which is our more external-facing technology, things that you probably see and interact with. Our websites, the way we manage state data, a lot of focus on emerging technologies, including generative AI and artificial intelligence, machine learning, things like that, as well as our Office of Technology Services, which is kind of the internal focus of all of this work. So our data center, networks, telecom, disaster recovery, all that fun stuff. So we've really tried to bake the idea of equity in both as a service provider, but also in the way that we think about technology at the state. So I look forward to talking a little bit more about that approach and hearing from some of my panelists about how they think about that too.
Thank you so much, panelists. So I just want to ground us in the work today and center us why ITEP is interested in AI and the intersection of AI and healthcare in particular. So as I mentioned earlier, one of the key pieces of ITEP's policy priority areas is the future of health and how we can use the power of emerging technologies to enhance health equity. We see population health management as one of the most promising applications of AI. The ability to connect and analyze social care data and healthcare data has the potential to uncover deep inequities in California communities, ones we're not even seeing today. By effectively implementing AI, we have the opportunity to address disparities and improve access to care for vulnerable and marginalized communities across the state. AI can help us not only streamline processes, but also ensure that all individuals receive the care they need, including preventive care. Would you like to share any opening remarks with the group, though, before we dig into today's discussion and questions to our fellow panelists? Any opening remarks you want to share? All right, they want to dig right into those questions. Let's get going with those. Thank you so much. So, the first one, could you please tell us how you're looking to use AI in your workplace? And I think we'll start off with Jason, and then we'll go to Joanna, and then to Jonathan, please. So many J's today, not intentional. We just all really care about health policy.
That's true. I really appreciate that introduction, really looking at this as an opportunity. And I think particularly when we're thinking about transformative opportunities in healthcare, we have to transform healthcare. It is not a perfect system, particularly when we're working with our most vulnerable and marginalized populations. We need to be more efficient. We need to be more thoughtful. We need to be more collaborative in what we're doing. And AI, machine learning, needs to be part of those solutions. I also am deeply curious about data. In West County Health Centers, we have looked at many different data sets around the opportunity for population health and looking from an equity mindset. We have geomapping, we look at hotspotting, we look at our data with looking at different data variables to look for disparate or uncovered, and trying to uncover those opportunities. There was a period of time that we thought about purchasing data elements from large actuarial companies. I could buy 600 elements from about Jonathan, about, is he married or divorced? Does he have a DMV record? Does he have, what's his education background? And in one sense, what we're doing is trying to collect these social drivers of health every time somebody comes in, which is great when I'm talking to you and dealing with you, but it's not great when we're talking about how to look at a population and looking at those needs. So we actually look pretty heavily at trying to purchase that in aggregate, looking at our populations to be able to to support kind of more equitable delivery and decision making, and how do we use our resources more wisely. And then I read the book Weapons of Math Destruction. If you haven't read that book, it's a great book to read. And we really looked at the impact of having that data that our patients didn't trust us with. That patient didn't say to me, Dr. Cunningham, here's my really vulnerable and internally important data, and I'm trusting you with it. I captured that from somewhere else, even though I wouldn't have that specific data about that individual. And it made me really worry about the trust of the relationship, and recognizing that my main product is trust. If somebody comes to me and is asking about their diabetes, they need to first and foremost know that I trust them, that they trust me. And we chose not to do that data initiative because we thought it could undermine the trust. And that's just one aspect of it. When we're talking about historic populations with historic trauma in healthcare, when we're looking at the data that's oftentimes wrong or misrepresented, and we're starting to learn from all those opportunities, we who have the trust of our most vulnerable populations need to be leaders in making sure we safeguard that. So that to say, this is the type of organization, the type of conversation that we need to really safeguard around what's the ethical implications and how do we walk forward with this? How do we co-design? How do we work with our most vulnerable populations for their voice within this? So for that in mind, I'm all geeky about AI. Let's do it. We use AI for mostly administrative tasks. We use it for when somebody calls in for our digital phone system and somebody uses a word like suicide or uses racial slurs. our AI system generates algorithms for them that we've put in there so that we can better, meet those needs. We use ambient listening tools for our providers to do scribes, basically. I don't think there's any reason that when we're doing administrative support around policy making and other things that we shouldn't use AI for making more efficient. Those are all, in my mind, administrative tasks around AI. What I've put a hard stop on is any decision-making tools using AI until we have a better ethical framework to understand what are the potential risks. And I mean decision-making tools from clinical decision-making, so we can purchase a tool that says somebody calls in with these clinical symptoms, this is the recommendation. They need X, Y, and Z tests, or they need to go to the ER or not. That's the algorithm creating recommendations. It's the same when we're saying, this is your population, this is what you should be doing with it. So when we're talking about population health, we need to be very careful we can understand where is that data coming from, what's the algorithm, can we discover what that algorithm is, what's the reliability of that algorithm, particularly when we're looking at AI's most opportunity is adaptive, that it learns from itself. So can we understand how to understand and interrogate that? I also don't know what the legal implications are for me as a CEO and as a health center. So I would say administrative, yes. Decision-making, no, or at least not yet. And I think that this is what I'm looking for. And the call to action I would like for this group and others to say, how do we shape the framework for the ethical decision-making around this? How do we understand what are the implications and how do we set standards for us to be able to make decisions moving forward? So that's where, again, compliance around cybersecurity and other things, making sure our data is protected, that's like baseline. It's much more about how should we be thinking about using it moving forward, particularly for our most marginalized and vulnerable populations.
I really appreciate your comments around trust and just the mistrust that marginalized communities feel with the healthcare system, with government systems as a whole as well. I think these are really important perspectives and comments to keep center as we're designing AI for California and what that will look like for healthcare. Joanna, would you like to answer that question? How are you looking to use AI into your workplace?
Yeah, thanks for the opportunity to talk about this topic. I think our folks are looking more at what is the lower hanging fruit in the community health center setting, some of which Dr. Cunningham alluded to. A lot of what we're exploring is around charting and dictation. So, they have software that's able to listen to a visit and then suggest, draw up a chart note for the provider to review after the visit. Another area is around translation. So some of that tied just to free translation of, regular conversations, but also tied back to the chart note. For example, if you have your whole visit in Spanish, that charting software can listen to your visit in Spanish and create that chart note in English or a suggested one for the provider to review. Therefore, cutting down on some of that administrative burden that Dr. Cunningham was talking about, improving provider satisfaction, hopefully decreasing pajama time. I think one thing we're also trying to grapple with, though, is where do we put our investments? How does that work? Because providers generally see one patient every 15 minutes, right? And so we can decrease maybe their admin time, but having this AI software doesn't necessarily increase revenue or create like a new 15 minutes, depending on how the clinic's day is structured. And so kind of thinking about, well, how does that work for a community health center who might be, have their revenue through PPS rates? Where does it make sense for them to invest? Where might they be able to get some help later? I think back to like meaningful use and EMRs. Is this going to be the next, new wave? We don't know, right? TBD. I know the governor's telling in California, the governor's telling everybody, like, we need to look at AI. But is that going to become a thing? I don't know. I would say in San Francisco, we're a heavily Epic-based ecosystem. And so I know, I attended Epic UGM recently, and they're trying to fit AI into, I think, every corner of every module that they ran. I know one that we also saw was around responding to patient messages. A couple of ways, one is just to take out all the things. The patients are very thankful, and that's wonderful, but it was filling up like 30% of providers' inboxes, So just from an efficiency standpoint, AI can draw those messages out, put them in a safe place, file them away. But it could also, suggest a patient note, right? It can look at what the message the patient sent over and prompt the provider, suggest a response back. Provider could review it, add, minus, whatever is needed. So a lot of our focus has been really around kind of EMR efficiencies to improve workforce, satisfaction and decrease admin time. And then around that translation, I'm outside, so they're cutting down trimming palm trees. But also to, we in the community health center world, we have very strong commitment to diversity, serve very varying patient populations. I know heavily in San Francisco for sure, we have a lot of ethnic diversity, and so how do we make sure that maybe AI tools can help support us in making sure that we are supporting all that diversity.
Thank you so much. I really appreciate your comments, especially the consideration around the investment. So if we invest in AI for our FQHCs and we're able to free up some of the providers' time, that doesn't necessarily translate into being able to generate an additional appointment time slot for the day. But what we hope that it would do would be increase the satisfaction of the patient, allow the provider to catch maybe additional things they may not have heard otherwise, gather more information, maybe during a conversation, have a more vulnerable conversation and setting in which a patient is saying, look, I'm really worried about how I'm going to pay rent next month, and a provider being able to make some connections to another program that they know of. So exciting things, and I appreciate his comments as well. So Jonathan, I know that you've really been tasked as the AI person for the state of California. I'm saying person in a jokingly manner, but you are the individual who is going to be responsible for these things. Would love to know how you're thinking about AI for the state of California. What's the administration's vision? Anything you want to share with us today regarding that?
Yeah, I should change my title to like human in the loop for the state of California or something like that. So as Joanna alluded to, we've gotten a lot of great leadership from our governor when it comes to Gen AI, and I'm really proud of the way that the state has kind of taken a very humble and deliberative approach. So rather than just kind of jumping towards either, hey, we can do it whatever we want with AI, there's no restrictions, we'll figure it out as we go, or taking kind of the other side of we're really scared, we're just not going to look at AI at all. I'm glad that we've taken an approach that really creates a lot of ways for us to learn by doing and build off of that to inform policy in the way that we're looking at it. So I definitely encourage you, if you haven't already, to take a look at the executive order that came out almost a year ago today, actually, from Governor Newsom, that really outlines our approach to Gen AI. And what's cool about that is rather than us taking a position on one of those two extremes, it lays out how we're going to learn by doing research and engaging with our community. So we started by conducting a report to highlight what are the benefits from Gen AI that we want to maximize at the state, and what are the risks that we want to prevent or mitigate. So, for example, we've gone out there and made it very clear that we never want to use AI to intentionally replace workers. We always want to make sure that when we're coming up with use cases, that they're used to augment and improve what our state workers can do. So we're building off of that idea of a human in the loop rather than just having that as a check. And then kind of from the risk side, we want to make sure, in addition to that workforce piece, that we're protecting the data of our residents. Just like you all spoke about, trust is really critical to us, especially because digital services and technology have such a great potential to make our service design and delivery so much more inclusive. But depending on how they're actually implemented, sometimes they can make things worse given the digital divide that's out there, or given certain risks when it comes to security or privacy. So building off of that report, we did an inventory at the state of how are we using conventional AI to get an idea of how different departments are using that technology. And then we came out with specific guidelines. So not necessarily policies, but like we spoke about, you can't use AI to replace human workers. You should use AI to simplify very heavily manual or kind of menial tasks that a worker may run into, things like that. And so now we're at the process where we're building off of those guidelines and turning it into actual policy. And two things I wanted to highlight are, first off, that I'm really proud of the level of community and worker engagement that we did throughout the process. So when I talk about all of these deliverables that we built into the executive order, all of those were created across our community. That means we reached out to our academic community with the University of California system and beyond. We've reached out to other governments, the federal government, international governments, county governments, local governments, reached out to community-based organizations, and we also reached out to the tech industry to understand from them. And one thing that's really exciting to me is we've taken a much more kind of engaged and deliberative approach to the AI policies and the AI development that we've done. So one thing, when we had started some of this outreach to these partners, we were just handing, draft policy documents or methodologies for procurement to community-based organizations or universities. And we found out that it can be hard for those to resonate through the jargon and some of the ways that we have to administer some of those different policies and ideas. So one thing that we've been trying that's been really successful is we've been hosting workshops to help inform the community on these are the things that we think are things that you should care about when it comes to AI, be it hallucinations or data security or deep fakes. And we found that by engaging in more of a deliberation around these outcomes, we've been able to get a lot more actionable feedback from the community around these are the kinds of things that we're concerned about, or these are things we're excited about when it comes to AI. So building off of that, we have 5 current proofs of concept that we're testing around Gen AI. 2 of them are focused on public health. One is working to automate and basically make it easier for inspectors to analyze inspection data on healthcare facilities, because as many of you know, there's a lot of handwritten notes out there. And it can be kind of difficult sometimes if you're trying to look back and see what happened on this date or in a previous inspection, or can we use all those handwritten notes and start to do some analytics and see, can we find trends in the data that maybe were harder to find when it was just scratched from an individual analyst or an individual inspector. And then we're also, kind of like Joanna said, we're using this technology to examine, can we better translate the public health information that we have out there? And that's an area that's both very exciting, but I'm glad that we're having, this discussion in particular, because it's an area where we're equally very cautious about what are the ethical and cultural and equity impacts. I think all of us probably have examples of throwing something into an automatic translator and the information either coming out inaccurately or in a way that doesn't really resonate with the culture. So we definitely are still encouraging our departments to find actual humans to help translate documents or give them some feedback. But if this could help, add language access to our materials to areas where it's a little harder for the state to find people internally who speak some of those languages, and we can use their feedback to help kind of guide the development of these systems, we're really excited. So we're excited to keep moving forward and start to think about now, not just some of these individual kind of learning exercises, learning by doing exercises, but think about how do we actually build this into our operation. So right now we're building out those internal policies for what does the department do when they think that Gen AI may be a good solution. And we're really focusing, which I'm really proud of, on those kind of outcomes as it relates to kind of AI comprehensively. So not just kind of typically what you might expect from a Department of Technology or a CTO, a focus on cybersecurity and cloud and all of kind of the internal things that we care about, but we're also thinking about what are the equity impacts? How might this affect service design? How does this relate to a digital divide that's out there? If you need a really high-powered computer or smartphone to use this service, are we going to leave people behind? So these are questions that we're asking up front, and we're engaging with our vendor community on as we think about different ways that we might be able to use the technology. And I'm excited to continue to work with groups like this one and get feedback from the community like you all to help shape what that engagement looks like, so we can make sure that we have that voice there as we're asking some of those broader questions internally about what's the most responsible way to use this technology and what are things we should be looking out for as we actually go to procure and implement it in more places.
Wonderful. Thank you so much, Jonathan. I really appreciate you talking about the deliberative approach that this administration has taken. And I like the example you gave about the two extremes and how California is somewhere in the middle. I feel like that's how we are at ITEP as well. We're very cautiously optimistic. Where it makes sense, let's do it. I think that Dr. Cunningham, Jason had a lot of good ideas around the administrative task, as well as Joanna said that too with the note taking. Really appreciate your comments and all of the ways that you're engaging our community members. So let's go to our next question, which is, how is AI currently being used within your organization? We talked a lot about the ideas about how we could use AI in your organization, but today as it exists, how is AI being used? And then where are you in the process of AI deployment? Would you say you're very early on? Would you say like you're getting more comfortable with the idea? Explain how it's going. And I think this is really more for Jason, Joanna today.
Yeah, similar to Joanna, we are allowing for using administrative AI, really helping reduce the administrative burden. And like what Jonathan was talking about, what can we kind of identify as reducing that kind of, pajama time, or however you said it, Joanna, like really making our systems more efficient. Specifically, like I said, we use it for keywords prompting for our call center when we're hearing words come in. That's often both a safety and making sure that our protocols are identified when we're having some sort of, oftentimes it comes up when somebody's in crisis or there's a racial overtone or a negative conversations happening, that we want to make sure we handle that appropriately and elevate that to the right person. So that's one use of AI that we're doing. And then we have an ambient listening scribe system called Freed that works great. We also have a regular scribe system, which is a lot more expensive. So I think Crispin had a really good question of how do we make sure that we're using this for efficiency and not reducing the staffing. In reality, as a CEO, we're looking at a $25 an hour live scribe or a $25 a month ambient scribe. And that is entering into my decision making. How do our providers feel about that? If they're going to take the live scribe, they have to have another half visit per day or per shift in order to make a pay. They can choose that. The AI scribe works very well. So in reality, it's going to go towards a direction of efficiency, and we just need to be really thoughtful about that as how we make. So I don't think we can't just say it's not. It's how do we make sure that we're using it effectively and making sure that we're thoughtful about the impact on our staff and on the workforce in general, particularly if we're employing frontline staff or staff from our community, making sure that we're not undermining our mission to begin with. And then I think the decision making, though, is what I'm putting a full halt on. Even if there's opportunity, there is opportunity for decision support for our nurses that are expensive, that could be working on more complicated, more interesting tasks around care management, care coordination. They're doing triage, which is really just about schedule management, making sure that they get to the right place. It's not a perfect use of a human, and yet I don't know what the implications are for the decision support coming out of an AI system, which is adaptive and learning, without really understanding what's the transparency. Is that auditable? How do I understand what their algorithm is? Is it reliable? So I know that it's happening the same time every time. So that's where I'm putting a full halt on, and I'm desperate for an ethical guideline. So less about policy and more about what you were getting at, Jonathan. How do we responsibly use these tools so that if you're thinking about using AI for decision support tools, this is what you really should be thinking about being in place before you move forward. This is how you look at the adaptive aspects and looking at transparency. This is how you look at the impact on your workforce. This is how you look at it, and just some best practices. And it's almost like we need kind of a decision tree. If you're over here, fine. Then make sure you have the cybersecurity and all the other stuff. But if you're over here, good thing to do, but be careful, beware, and these are the things you need to have it put in place. And I haven't seen that as much. I've seen a lot of the cybersecurity and some of the guidelines, but I haven't seen a lot of the ethical guidelines for leaders making decisions on where deploying that. So I'm really interested, particularly for those like this organization who has the mission and the historic trust of our vulnerable communities. How do we make sure that voice is included in this as well? So.
Some really good considerations, Jason. Thank you for those. I was reminded of our Children Youth Behavioral Health Initiative and the apps that have been developed with the state for teens, I believe ages 13 maybe to like 24 or so. Don't quote me on the exact ages there, but they do utilize AI in these apps and are flagging for things like suicidal ideation. So how are we doing that? I'm thinking in terms of the ethical guidelines. I know that Kuda spent a lot of time thinking about this conversation. So I wonder if there are any things from lessons learned from that experience for the Children and Youth Behavioral Health Initiative that maybe we could use for our FQs and our community health centers across the state. So just got my brain spinning a little bit. Before you answer this question, I want to ask Jonathan, could you speak a little bit more about the work that CDT is doing with the California Department of Public Health and any additional updates you want to share? I know you've given us these 2 proofs of concept. Where are you in the process? Can you share how we can plug in as community members and nonprofit advocates?
Yeah, and I think we'll have more to share later. We're still, so the way that we're really treating these as kind of co-design, co-development efforts. So these truly, when I talk about the proofs of concept and the 2 use cases that we spoke about, we really are looking at them to build off of the solution or the problem that we're looking to solve, I guess is a better way to put it, rather than just, oh, this company offers a chatbot or this company offers enhanced search. So it will take a little time before we can share progress, because it's a lot of like prototyping and testing and a lot of development work that I find really exciting, but we don't want to necessarily overpromise. I can say that it's been really interesting to see how CDPH, our public health department, is viewing everything. And for the most part, I think people are really seeing a lot of potential in this technology to improve the capability of analysts, particularly in the ways that we spoke about, like moving from kind of a totally manual written analog process to something that's highly digital really opens up a lot of options. And it really allows, hopefully, some of the analysts who would be reviewing those notes and studying things to free up their time to focus on some higher level questions that otherwise would have taken them a lot longer. I would say in terms of like what is our role as we're working through this, we're really trying to empower departments, including CDPH and the broader even Health and Human Services Agency in California, to just make the right decision, help them think through some of these higher level questions. So we're thinking about that kind of across a variety of different areas. And it's everything from, on a technical side, this ties into what Jason was talking about, like what do these departments need to be ready to really use this full time if it's something that they're interested in? Do we have the compute power that we need? Are we designing these solutions efficiently enough that they're not going to be either an adverse environmental impact or an adverse cost impact for our residents and for taxpayers? And then thinking about the use cases and the data, we're trying to, and this is especially where we'd appreciate feedback from the public, we're trying to understand where is that boundary line? So where do we think that the costs or the risks associated with maybe data being used for a particular model or for training or something like that might outweigh the benefits of being able to analyze it and study it? And particularly when you're talking about things like health, there's a lot of very personal information that might be out there. So we want to be respectful, not just from like a legal and compliance perspective, but also having empathy for our residents that, you may not feel comfortable sharing this information for use for some of these broader like analytics platforms. One thing I do want to make clear is we're designing all of that into these initial proofs of concept and the way that we're testing. So we're only using publicly available data. We're making sure that that data is vetted by CDPH before we move forward. So even in the exceedingly rare event that, in testing one of these solutions, there might be a security incident or there might be something that comes up. There's no risk to the residents. We're not using like state data, and all of that data is going to remain the property of the state. So it's not going to be used for future models or training or anything like that. So we're building that into the way that we're looking at things, and then we're slowly kind of moving off of that and trying to think about like, give CDPH the tools and a framework to think about some of those questions so that as they're looking at the potential to move from a proof of concept to maybe a pilot using some real data or on an actual network or something like that, they can ask some of those questions about, well, what is the most responsible way to use these data? What types of data do we think would be helpful? both from like an efficiency standpoint, because if you just throw a ton of random notes in there, it may be difficult to get good answers, as well as from a security and empathy and a privacy standpoint. So we're there, not as like an approval step or there to be like very strict and punitive. We're really there to continue that conversation and also to extend some of the discussions that they're having to our broader network that we talked about before, from academia, all of you, our community, industry, so that we can have a really educated decision and answer some of those questions up front instead of kind of deferring some of those high level questions until after we've built the solution. And then we need to kind of figure out like, okay, how do we make this work responsibly instead of what we're doing now, which is designing it in from the start.
Absolutely. Thank you so much for answering that question. We have some more questions coming to the chat, but I want to give Jonna a opportunity to answer the question we had posed earlier around how is AI currently being used at your organization and where are you in the process of deployment?
Yeah, thanks for that. I would say we are dabbling with our health centers. Dr. Cunningham mentioned Read earlier, so we're like dabbling in charting, dictation kind of tools, assessing what kind of investments we'd want to make and how we fund that sustainably. Like Read is sort of a lighter tool, I guess I would say. It's freestanding, not integrated into our EMRs, but if we wanted an integrated tool, it could cost like 3 to 10x, what that costs, right? So where do we start and make sure we have like proof of concept and before we make larger investments? Then I would also say, there's resource challenges even just to the assessment of the tools, right? And so that's somewhere where a place where I'm hoping at the consortium level or state association level, or even, talk to the National Association of Community Health Center CEO recently, where, we'd love to be able to support community health centers in doing that. I have very sophisticated clinics all the way to like clinics with one IT person who does, networks, EMR, like the whole, they're one man, one woman show. So it could be rate limiting to, even starting to assess any kind of tool that might be suitable for clinics that may be a smaller shop, but then we have to face the question of equity, right? So how do we, if the smaller shops don't have time to invest in differentiating which tools work for them, which tools make sense to invest in, then is that just furthering the divide, for our health systems, right? So we want to make sure that community health centers do not get left behind, and how do we, as like a community, make sure that happens? Because that's how we improve and sustain, from a DEI perspective. Oh, sorry, and one more comment I meant to make earlier. I know there's a lot of discussion about and concerns, maybe from a broader perspective of Gen AI replacing workforce, but I will speak at least for healthcare and community health centers. I do not know anybody that has like no jobs open from our communities. Workforce tends to be our number one issue right now, and so we're hoping that Gen AI can help bridge the gap. I don't think any concern from folks that I talked about, at least not the immediate future, that like, oh my goodness, Gen AI is just going to solve all of our workforce issues. I think that's definitely still going to be there, but those operational efficiencies from the tools we're hoping will help. So we're not thinking that there's a threat at the moment.
Thank you so much for that. I was really struck by your comment about not leaving FQHCs behind. When we saw the rolling out of EHRs, that's exactly what we saw. We saw FQHCs being left behind. We saw smaller clinics being left behind. Transparently, my PCP still uses paper records. He has a little file and has my name on it, and he sits there and jots down notes as I talk to him. And I am so struck by this idea that the potential for AI to uncover disparities that we don't know exist currently, to connect individuals to the social service that they need in order to have healthier lives. Because we all know if you don't have housing, your health is probably not going to be in great shape after you lose housing or in that period of that you're experiencing homelessness. And I'm very struck by this idea that the individuals who would most benefit from AI may be left out or left behind because they're seeking care at our safety net centers. So I want to pose a question to our panelists today. Can you please answer this question for me? Who are we optimizing AI utilization for? Who are we optimizing it for? Who should we be optimizing it for? Carry that thought through your comments. I'd appreciate to hear what you have to say.
I was struck a little bit just with Jonathan's comment around access and making sure that our communities have access to these news tools. That's an area that we think about a lot, but I haven't put that in the AI front with kind of how we're thinking about that. And I think that's important. But I am also quite interested in how is the data making decisions? What is it learning on? What's the data set that we're creating our knowledge from? And that's one of the main areas I think that we all struggle with. And that's not just because we serve vulnerable populations that may be marginalized or not have access to the system in general, and therefore we're assuming that the data represents how many patients have hypertension or what the medication is best used for or whatever, and it's only being written by those who have been able to show up to the clinic and have able to have the decision made. That itself, you're leaving out a whole population, particularly for those of us who recognize that even our community health centers aren't serving those who are most marginalized because they can't oftentimes get into the clinic or we're not reaching them. So we're creating and reinforcing the risk of the data set being wrong, and then the decisions we're making are based on data sets that are wrong or even biased or purposely biased for different capital decision making or whatever. So I'm not sure I'm there yet to say it's optimized. It's more of like, can we make sure the voices of those who we serve are accurately represented? And can we make sure that we're including them in the value creation of this? So it's not just about efficiency. It's not just about making a more productive situation. And that's what I think about a lot is like, well, access is only good if you have somebody who's actually able to come to work for me because, I can't hire the same person that somebody else might be able to. But the real mission is, can humans be served in a way they want to be served and it makes sense for them? So if we're not thinking about the way we're creating value and including those voices in that decision making, they're not going to be included in the data, and the tools are not going to be made for them. So I'm more interested in inclusion than I am about what we're creating. It's more about how we make sure that our system is learning from those who are the most vulnerable or oftentimes most marginalized historically.
So I'll jump in and add to that quickly. I'm glad you asked that question because this was something that we actually spoke about as we were preparing for this panel. And it's a question that I've been asking a lot at the state. And to be a little bit more specific, like when I've been asking that question, it's not as much specifically as like, what is the that question, because there can be some assumptions built into questions that you may be asking an AI system. So the example I gave earlier when we were talking about this, and I'll share with you now, is one of the other areas where we'll engage in a proof of concept. And to be fair, we're also trying this out with a focus on what we call vulnerable road users at the state. So bikers and pedestrians, but we're looking at, can we use Gen AI to help traffic analysts at the state? Can we use Gen AI to combine a bunch of different types of data and allow traffic analysts to ask questions directly of that? And we've actually found that it's extremely helpful in saving time and development resources. And in some cases, we can ask and answer questions that might have taken months or weeks of programming and research in a few minutes and like an hour. So there's a lot of great potential there for those analysts. But the question that I'm asking is, if we're optimizing the road, like if we're trying to reduce as much traffic as possible on the freeway, who are we optimizing that for? Who are we considering as part of that? And I think Jason brought up the questions that I'm hoping that you all are asking, which is, okay, when we're looking at the training data, when we're looking at how a system is considering a denominator or a numerator for some of these proportions, like who is included as part of that and what does that mean? Because we could optimize traffic for pedestrians, for cyclists, for people who have cars, for people who are using public transportation. Those are all, taken to the extreme, very different ways to organize roads or set traffic laws or speed limits or whatever that is. And I want to be clear that, we're not coming out and saying there's potentially like a right way to do that, but especially when it comes to something like health, you do want to be thinking about, are there groups of people who may not be counted in those data because maybe they're not documented, maybe they're not housed, maybe it's only looking at data from a particular race. Maybe we know historically that for this particular type of information, there's groups that may not have been adequately considered or counted. So you need to constantly be asking that question and kind of digging deeper. And that's something that we're doing, which is what Jason's talking about, reviewing training data, asking questions about where things come from, and understanding that a lot of these tools are tools that you're going to have to develop and fine tune. They're not really like full-fledged complete products. They're things that you have to kind of teach how to work correctly. So you may need to bring additional data to make sure that it's representative of the population that you're looking for, or you may need to teach it to understand what certain words mean or what you're really looking for, because a word may mean something differently to the AI than you would interpret it. So this is a really important opportunity, not just to think about AI from a technology perspective, but when you're considering some of these use cases, doing the due diligence and finding experts who can help you think through, how are these different systems set up? And this is actually the main thing when I work with, private sector companies or vendor partners, and they ask like, what can we do to help with responsible AI implementation? I really focus on, give us more data and transparency into how you're looking at what's out there. Most cases, the AI bot or the algorithm is going to be looking to maximize productivity or efficiency. But again, like, what does that actually mean in the course of the real world? So strongly encourage you to ask those questions and dig a little deeper and make sure you're validating that what is going through these systems actually represents the population, the world, the reality of the program that you're trying to improve.
Joanna, yeah, go ahead.
Yeah, I would just add, yeah, I definitely think we have to bring it back to the patient and keep the patient in mind. I mean, I like one example that I'll give is just the way we think about data in general. Like there's questions I've seen on here about data governance and security and all of that. And I think at the end of the day, a lot of times, a lot of places, but especially in healthcare, data has become big money, big business, and we forget that patients really should own their own data or have power, control over their own data. And so there's a lot of, like I said, big power, big money. I'm like, no, we can't share this data because this, we're going to use it for this and they're going to use it for that. I mean, I've been in some of those conversations. It just blows my mind because it's like we totally forgot about who we're serving or who's supposed to really ultimately benefit from this, and that should be the patient. And so if I apply that thinking to our AI conversation, same thing. It's like we cannot forget that. I think, of course, we would have more efficient workplaces, happier employees, more efficient healthcare systems, cut costs, increase sustainability, all of those things. But we just cannot forget that at the end of the day, the patients have to have that better patient experience, improved patient health care, and that's really like where all the AAA results are going to come from.
Absolutely. Thank you so much for digging into that question. We're getting some more questions in the chat, so let's see where we want to go next with this. So, Joanna, you were talking a little bit about data and privacy and the ownership of data. So, a question we have from the audience: how can we balance the need for data privacy with the requirement for large data sets to train effective AI models?
If anyone knows the answer for that, please email me. That would be great. I think for a lot of these things, because it is a new technology, there is not a good answer. I can give you a couple of things that I'm thinking about, but the first I would say is you need to be cognizant of that as a potential risk. there's as big as the internet is, there's only so much information out there, and there are models that are being run on what's called synthetic data, so like data that's actually created by another large language model to try to increase its capacity. And there's some that are being run on different data sources that are out there. And like Joanna was talking about from the healthcare perspective, that's going to be a really interesting thing to see in the tech industry, because there are groups out there like the New York Times, for example, sued OpenAI saying, wait a second, we don't really think it's fair that you can just go to our website, pull everything we've ever written, and then use that to build your multi-billion-dollar company. And so that's something that will need to be figured out moving forward. I would hope that what we would see is just transparency and empathy for people who may be considered as part of data being used to train what we have. I would hope that there's going to be a fair level of transparency when you're using data or when you're looking for data to train a model, and that, especially if we're talking about patients, that's being communicated clearly. One thing that I'm happy to highlight is we've done a lot of workforce outreach as we've been starting with these initial proofs of concepts for Gen AI at the state, maybe in some cases more than some of our employees would like. But from the beginning of that process, we've regularly communicated out to employees, here's what we're looking to do, here's how we think this will affect you, here's the types of data that we're using, and we've given them an opportunity to provide feedback. I'd hope if there were significant investments in AI from the health side, that you'd be doing that with your patients or your community as well. You don't necessarily have to give away every proprietary idea or every private piece of information, but I do think we have a responsibility to maintain that trust by getting that information out there. The other thing I'll say is I would not overly rely on large language models to solve very specific problems. So if you're looking to create a note-taking tool or something that can help summarize a bunch of information that's out there, something that can help with maybe search on your website, then generally I think a large language model could be really helpful. It's really good at being able to process information and generate language in a way that's much more conversational than what you sometimes get if you're developing an algorithm or something like that. But if you're looking for something that's very specialized, that relies on a very specific population, you may need to really focus on, kind of like we we're talking before, about making sure that the data that's in there, or the way that it's called fine tuning, but basically kind of guiding the model, this stuff is relevant, this stuff is not relevant, I'm interested in these kinds of things, may need to be more specific. So the bottom line of all of this is it's going to depend on engaging with the community and the group of people who are affected and making sure you have a transparent and open discussion with them, because I think people really deserve the right to know when their data is being used for these kinds of purposes. And also, I think you'll find that there are folks in the community who could see the value in working with you to try to use AI, like Joanna was saying, like Jason was saying, to really increase the capacity of some of what your organizations do.
I think this just begs a whole different. I was just going to just open up a bigger can of worms too around who owns the data and who's getting the value from the data. And I think this is where historically we have not done a very good job of the governance and understanding that the value creation is for a certain cause. And there is going to be money made. Healthcare is a money making or entity or endeavor. And so there's going to be opportunities there that for profit. So who's benefiting and where is it really led toward? I lived in Copenhagen for a year and interviewed with a company called MyData, MIDATA, which is a Swiss company that uses blockchain, and it's a not-for-profit organization that's a co-op model where the owners of the data are the data holders, and they use a blockchain. Those elements are then able to monetize. If your data is being used, they would get benefit, and that any commercial opportunity that happens because that gets put back into the co-op, and that everybody kind of then can benefit from it. Those are some very interesting thoughts about how do we think about data governance. I'm not sure that's feasible, but I think that's what we need to be thinking about when we're talking about opportunities for some of this data set. And I haven't seen that really push forward. So it'd be interesting.
One more comment I had, no offense to Jonathan, but think of the example. I think we need guardrails, but I've been looking at some of the stuff in the chat too. And I think a lot of times I would just say, in healthcare, we have a lot of regulation to protect the patients, but sometimes it also is a barrier, especially on technology front. So one example I'll give is I used to work at a health plan, and we wanted to text our members for patient engagement, member engagement, but we fell into a category of like big business, like Comcast, where the government did not want us spamming our members. But we did not fall into the category of like a healthcare provider who has a provider-patient relationship, who can text their patients really at any time. And so, because of like how the regulations came about, really provided a lot of barriers to like health plans being able to engage with their patient population. We had to get opt-in, for example, and nobody was, actively opting in. We said, can we do opt-out? They said no. So, things like that, I think we do have to be thoughtful about. Of course, we want to have security. We want to have agency over our data and security, but at the same time, sometimes is regulation that makes it, can be a barrier to like ultimately where we want to go. So I agree. Like I want to have open lines of communication, stakeholders, and make sure that we find that right middle ground.
Absolutely. I think you've given us all a lot to think about today. Before we dig into some of the questions coming through the chat, I just want to pose one last question for our panelists. So given everything that we've discussed today, we've been kind of all over the map in terms of AI, and there's so many applications. Jonathan talked a lot about the California Department of Public Health and the proof of concepts he's doing there. Jason's talked to us a lot about considerations for the building trust within our communities as it relates to AI. John and I talked about all the things that we can use AI for to help decrease provider burnout. So given everything that you've said today, give me a hot take. What are the key considerations you have to use AI in your organization and statewide?
Did you say key considerations?
Yeah, key considerations for your organization and it's statewide as larger.
I think we should be curious. I think this is an opportunity. It is going to be transformative. It should be. I think healthcare is ripe for transformation. So I think we should be curiously positive and optimistic. And I think we need to be very cautious about how we're leading and representing the voices of our most vulnerable in the community. And how do we set up those learning in communities? How do we set up the governance models? How do we look at some policy guardrails that talk about transparency and auditability? How do we understand the data sets that you're getting at, Jonathan, around who's included in it? I just think we need to do a lot more pausing and thinking, and I'm not sure that's easy to do. The cat's out of the bag. It's moving forward, particularly when you have money involved. So I'm very thankful for this type of conversation. I think this is where organizations like the uninsured project is really allowing us to have, your mission is being carried over here, and you're able to lead us in that. I would want us to call to action, though, of we need to do that actively. We need to be able to set some basic, doesn't have to be exact, some basic principles that we need to be thoughtful about, that we need to consider with our organizations, with our communities. So it's not going to be exact, but here are some principles we need to be including in anything we do, particularly around decision support. So.
Yeah, I guess the hottest take I can give is just I would probably not focus on the technology as much and really focus on defining what it is that you're trying to solve, and really just being open to looking at some different solutions and testing those things out. I think I saw a question in the chat, or somebody mentioned in the chat about, or at least put a Q&A question in around like, how do I get people to want to adopt Gen AI? And I don't think I would look at it that way. One thing, and that's why we're being very specific about doing a proof of concept and not just investing in this technology, is, build yourself a safe space to try some different options out. When we talk about proofs of concept, all of the different, use cases that we're talking about, including the ones with public health, we're actually doing multiple proofs of concept at the same time. So we can see how does it work with different approaches and environments and technologies. So about what are those outcomes that you care about, come up with some different hypotheses for if you are trying to reduce burnout or use data better, what might that look like? And try it out on a smaller scale. And if those things work, you might be able to build some momentum around, like we were talking about, look, I was able to take this process that may have taken months and we can get it done in a couple of hours. And those kind of like more objective data points are going to resonate a lot more with leadership than sometimes some of the more abstract ideas, even if we know, in 2024, soon to be 2025, that data is really powerful and we can do a lot with an analytics platform or data visualization.
Definitely echo a lot of Jason and Jonathan's comments. It's, how do we make sure we define our questions and problems that we're trying to solve? How do we create a safe space to do that? How do we not let the perfect be the enemy of the good, right? Especially like with smaller organizations as well, so that they can dabble, they can do lean launch kind of methodology, right? And try something out, and maybe that'll convince some other like providers, like, oh, this is not what I thought it was. This is pretty cool, or whatever it might be, right? That instead of like trying to convince folks to adopt, like what Jonathan was saying about how do we get folks to adopt, it's really a little bit of show and tell at that point. So I guess I would say, yeah, I mean that we need to continue to dabble, but in a safe way.
Thank you for all those. I really appreciate them. Let's dig into some of the questions that are coming through the chat. So the first question I have is for Jonathan from an audience member. Can AI reach its full potential without exacerbating environmental damage? And how can we ensure that the environmental impact doesn't disproportionately affect marginalized communities?
Yeah, I think
Not a
that's
hard question at all.
Yeah, that's another one. If you know the answer, please email me. That's something that we have to be really cognizant about. I think there is some optimism that as, and quantum computing is kind of really far away, but just even as companies are able to just get more efficient on compute power and storage, that this will be less of a concern. But there's an article even in the Washington Post today, which you should check out, that shows just like how much water is used just for like cooling and plant processing. So we're not even talking about like electricity consumption and some of there's so many resources, be it like human capital, environmental resources, all kinds of things, data that can be used really inefficiently here. One thing to think about when you're thinking about even like using some of this technology to like help summarize your meeting notes is like you're using enough power to summarize like the entirety of the history of the internet to solve some of these tasks. So it's necessarily going to be very resource intensive and also very expensive in a lot of cases. So one thing that we're really focusing on is just if we know that you need to look at the entirety of the internet to answer every question that goes to one of these models, we're thinking really critically about, okay, if we're building a Gen AI application, how many of these questions really have to go to the model, and how many maybe can we solve using more conventional technology that is not as resource intensive? So the short answer is, I think the potential is there to find a middle ground, but that's something, because it's still being developed, that you should be cognizant of and you should be thinking of, and you should really be pushing for folks to think about the efficiency in terms of data and resources in as well as data and resources out when you're looking through some of these solutions.
Thank you so much for that. Another question. Have we seen any cybersecurity issues as it relates to AI? And if we have, what is the state doing to protect us against those? What are some things we can put into place to guard against those? Maybe another question for Jonathan, but
Yeah.
Jason, Joanna, if you have any ideas, feel free to
I'm
share
interested,
those too.
how Jason and Joanna are thinking about security, especially from their perspective. I will say, as we spoke about before, obviously there's some pretty significant security risk when it comes to AI. The way that we are looking at it is in terms of kind of new risks and amplified risks. So kind of the contradictory things that we've been doing at the state is we've really been innovating in the way that we govern and secure this technology. We talked about some of the different approaches that we're taking. But on the other hand, there's a lot of work that we're doing, and we have been doing that is still relevant. A lot of the levels of security controls that we have in place, a lot of the work we've been doing with federal government and international governments to secure data are still extremely relevant and are still sufficient to guard against some of the risks that we're seeing with AI or Gen AI. But there are some new risks that come up when you're using this technology. There might be some risks that are amplified. And so kind of to what we've been saying, I would say the focus for us has really just been on kind of the basics. Like a fundamental thing that anyone can do that's going to be really helpful is just data classification. There are a lot of systems, and there are more systems now that will have AI tools built into them. You need to know, what data is hooked up to those systems. Are you appropriately, labeling? And I'm sure in the healthcare space, you all are very focused on that. But are you labeling that data as HIPAA or confidential or sensitive or whatever it may be, so that as you're building into these systems, be it like Copilot in Microsoft Office or something that might be an Adobe Acrobat, those systems know, oh, wait a second, this is really sensitive data. This should not be going to an LLM or be brought into a broader system. And there are ways that you can responsibly do that. So we're really just trying to make sure that our state departments are following those really like fundamental principles around data governance and data management, all while we're still kind of working on the cutting edge to make sure that we're being proactive in addressing those risks. But I would say system that you have, and also be evaluating the way that you're behaving to make sure that there aren't any vulnerabilities that might come through, even if you have a perfectly designed and secure and totally safe and closed system.
Yeah, just speaking of that, we've been talking about the opportunities in healthcare, but the reality is there's a lot of bad actors who are going to be using and are using AI for other purposes. And so we have really thought about that carefully. That's an existential risk for us as an organization. And that doesn't include, again, our most vulnerable patients and most vulnerable information that our patients are trusting with us are then becoming exposed if we don't have that layers of security and additional layers of security. So I think that just in general, I'm thinking about that from my administrative hat of how do we make sure that we're being thoughtful. It also begs the question of equity related to the vulnerability. And so particularly the safety net, those, we're all working on a shoestring budget. We're all working with smaller, inefficient systems because we're in small communities. It's not set up to be effective and efficient for administrative scale, and so are there opportunities for us to be thinking about this from the consortium level, from state grants and other things to make sure that we're focusing on um, prioritizing investing in the cybersecurity and the oversight for our most vulnerable communities. That is, we're expecting to be. In fact, we're hacked all the time. Luckily, it hasn't been productive, but it's becoming more and more common. And so how do we make sure that we're safeguarding it from a population and a community's perspective? That's going to take investment. That's going to take collaboration.
Just something small to add. I mean, yeah, definitely thinking, I think most places are doing their best of what they can right now on the security front. And a lot of what we're seeing is like the unknown of the unknown, things that people don't know to expect. But I will say something really basic that just brought it back down, talking to some folks who've had incidents and just lessons learned. We had folks even that they had like 3 computers. We had staff that had like a desktop at home, a laptop at work, and some whatever, and like after each security incident, every single piece of hardware has to be secured before anybody can use it again. And so you think about, even on that just kind of blew my mind. I was like, oh yeah, I mean, so each staff person could be like 3x, 4x pieces of equipment that need to be secured after an incident. So even things like that, we're just like, okay, thinking administratively, like what Jason was saying, how do we even just cut down on that? That's the most basic. And I would say prior to this role is my first CEO role, and prior to this role, after joining the company, the bad actors just scared the crap out. I've never had so many people try to impersonate me in my whole life, and so they're using different cybersecurity kind of tactics. But so I bringing new light to awareness as well within the company. So we're always asking each other, like, did you send me this? Call me, text me, verifying, things like that.
Thank you so much. I think we've got time for one more question. So I'm going to go ahead and pose this one. We've got some more in the chat that I think we can follow up via email. But thank you for those. So the last question is, AI presumably isn't going away. So I'm curious on what are some helpful approaches or strategies for minimizing resistance to adopting or at least exploring AI in their work? And what are some approaches that have worked for the panelists?
I love the way Jonathan approached it, and what Joanna was saying is that there's plenty of work to do that we can make more efficient, and looking at that from an opportunity, picking out what you're trying to accomplish first, and then having solutions rather than just saying we're going to implement AI, and then being really careful about talking about what we're not doing and that we're safeguarding this other thing. It just there's so many inefficiencies in healthcare and so many opportunities that we could really leverage this, off the shelf, proven, vetted technologies in this space, and then gain trust, and then figuring out how we can do that together within a leadership team to understand how we're doing things and how we're vetting it. So.
I would just add, just really, like I was talking about earlier, don't let the perfect be the enemy of the good. Try something. So if you something safe, you feel comfortable, at least some folks feel comfortable with, or I've seen some of the clinics have like a physician champion or somebody, some champion within the organization is like, I really want to try this, and it's just really have, admin like vetting that, but allowing them to do that, and then having that, people touch it, experience it, try it on, see if it fits, right? It really helps folks see that it doesn't have to be big and scary. Like it has the power to be, it can be, but it doesn't have to be. It could be an app on your phone that listens to you, and creates a summary of what you talked about, right? So, I think for us, like that's the easiest way that we've gotten folks to be able to just say like, oh, and that's AI, or just saying like, telling folks, whatever you would put into Google, put in a ChatGPT instead, because people are perfectly comfortable asking Google all kinds of questions, right? So we're just saying, open up ChatGPT instead, put it in there, and see what you get, right? So I've been telling all like the admin, any creative staff, do that instead, see what happens.
Any final thoughts, Jonathan?
Yeah, I'll just add to, build in, and just in general, when you're trying new solutions, like we spoke about, please build in that space to experiment safely. So, as you can see, that's the approach that we're taking at the state, but, legitimately evaluate some parts of the technology, and kind of like Joanne was saying, feel free to experiment, but do it in a way where it's secure and safe, and you don't have to worry about some of the negative consequences. So maybe start with, if you are going to play around with ChatGPT, start with some stuff that might already be on a website instead of feeding in like actual patient data or something like that. But I really strongly believe that like a lot of it is building momentum with positive results if it's really there. And so if you're able to start to demonstrate some positive results, it's a little bit easier to go back and say, okay, we've been able to show that we could do this. Could we maybe have a little bit of resources so that we could see how might that work at scale, or how might that work somewhere else? And the good news is there's a lot of people working on AI. So there are a lot of different things that you can find from other healthcare organizations, from universities, from different researchers, to see what different ideas are out there. So hopefully you're engaging with this broader community and the excellent speakers and ideas that you've heard today to help build that up as well.
Thank you so much. I want to thank all of our panelists for their time today and sharing their experiences with us. Thank you so much for being with us today. I want to share just one final announcement before we end our time together today. We're going to have our next policy forum on October 17th from 1:30 to 3 p.m. And this policy forum is going to be focused on, I know we're pulling up, thank you. It's going to be focused on behavioral health and the justice involved population. You can use your phone to scan that QR code real quickly and go ahead and get registered today. Again, a big thank you to our panel. We explored so many topics as relates to AI, and it seems like the future is very promising for California in the face of AI and healthcare, and we need to consider centering the populations who will be impacted the most by this technology. So again, thank you for your advocacy, thank you for your work and for your time today. A big thank you to our audience as well for being here. None of this would have been made possible though without the dedication of our ITUP team. I want to thank all of them in attendance today for all of their many efforts in making this possible. Please use the event evaluation in the chat to share your feedback regarding today's policy forum. Thank you for your time, and we'll see you on October 17th for our next event. Thank you so much. All right, thank you. I think it was amazing.